Welcome back to your OncoCare Advisor. This is Dr. Raghav here. I often get a question from my patients who are going through early stage breast cancer is how long should they take hormonal therapy or the endocrine therapy? That's a very important question to answer, and the answer is not very straightforward or black and white. Hey, this is the duration you should take. While we have made a lot of advances in understanding what is the optimal duration of treatment of the hormonal therapy, but it's important to understand other nuances as well. So basically what it means is, simplistically speaking, you should be able to ask your doctor, how long should you take this treatment? 5 years, 10 years, longer, etc. So let me break it down for you. Okay. So this is called extended adjuvant endocrine therapy. Okay. So I'll give you about 3 scenarios here. So when someone is diagnosed with an early stage breast cancer, they undergo surgery, let's say left breast cancer, undergo surgery, lymph nodes removed. There are different scenarios that happens. The tumor size might be smaller, bigger. Lymph nodes may be negative or limited positive, means less than 3 lymph nodes positive or more than 3 lymph nodes positive, right? So let's say whether they got chemo or they did not get chemo, but it was decided that you need endocrine therapy, like a tamoxifen or letrozole or anastrozole, something like that. So there are 3 situations that I'm going to describe. The first situation is a very easy situation. Someone, let's say, actually, you know what? Before I go to the situations, I want to highlight about some of the factors we consider if someone should receive 5 years of endocrine therapy or 10 years of endocrine therapy. It ranges: age of the person, medical comorbidities of the person, meaning if they're having any other symptoms associated with other medical problems. How did they tolerate the first 5 years of endocrine therapy? Because that dictates what we should do next. And patient's decision about what they want to do. Do they want to take longer treatment if offered? And also, how does it impact their long-term risk of recurrence? So anytime when a cancer is diagnosed, we look at 2 parts. What is the risk of this cancer coming back in a short period of time? And what is the risk of this cancer coming back in a longer duration of time? So now I'm going to describe 3 situations. The first situation would be someone, let's say in their 50s, diagnosed with breast cancer, early stage, small tumor, let's say 1.5 centimeter tumor in the breast, lymph nodes are all negative, hormone positive, HER2 negative. Very straightforward. This is a person where I would not recommend adjuvant endocrine therapy beyond 5 years. And the reasons for that is, it was a small tumor, meaning the risk of long-term recurrence is under 2%. That means the benefit the treatment is going to offer is very negligible. So pretty straightforward, 5 years of endocrine therapy is usually sufficient. Another very clear situation is, let's say if someone is diagnosed with a 4 centimeter breast mass, hormone positive, HER2 negative, let's say 5 lymph nodes were positive. This is a patient where the long-term risk of recurrence is much higher, meaning if you add about 3 to 4% per year, the cumulative risk is about 30% over 10-year time frame. Oncotype DX is a kind of test that doesn't shed much light into the long-term recurrence. So this is a patient where I would certainly recommend long-term, that means up to 10 years of endocrine therapy or hormonal therapy to reduce the chance of recurrence as much as possible. So straightforward. Now, third case scenario where there's a lot of discussions that can happen is these little tough cases about, let's say someone diagnosed with a breast cancer where 1 lymph node is positive, or larger tumor size, but lymph nodes are all negative. We call it N1 disease or T2N0. That means the tumor size is larger but no lymph nodes. These are very critical, difficult situations. In these situations, I look at several factors. Who is the person? What's the age? What is their motivation to continue treatment beyond 5 years? And I also use a test called Breast Cancer Index. It's called BCI. So Breast Cancer Index will give more objective evidence in terms of understanding the risk of recurrence over an extended period of time. Many times this test could come back as high risk and the benefit will outweigh the risks, but this is certainly helpful for the patient also to make that. Again, I always talk about shared decision making, means the patient understanding what is the risks, what is the benefits, and working with their doctor to make their decisions. So this is really helpful, what is called Breast Cancer Index, that is typically done at the end of that 5-year mark to predict that long-term benefit of continuing the endocrine therapy. So I always close in 3 points. The first point is discussing with your doctor to understand the duration of the endocrine therapy, 5 years versus 10 years. The second part, once you made the decision, understanding what is the rationale behind that decision. Is there anything else that can be helpful to predict that long-term benefit? And third point is knowing that it's not a single point decision, but a lot of factors come into play. Who is the person, age, medical problems, long-term benefit, long-term risks, risk of osteoporosis, and more importantly, shared decision-making, coming together to make the decision. So these are the 3 points to remember. Next time, if you're someone who is diagnosed with breast cancer, early stage, who is going through endocrine therapy, don't forget to ask this question. Are you the candidate for long-term endocrine therapy? If so, why and what you should do about it. Hope this was helpful. And again, if you have any topics, any scenarios that you want me to cover, please DM us and we'll be happy to do that for you. Thank you for your attention.